If you're living with chronic pain, you know it's not just one thing, not even close. It's this confusing, overwhelming whole body experience. So today, we're going to cut through all that noise. We're going to reframe chronic pain, not as just some simple injury that won't heal, but as a really complex team sport happening inside your own body.
You've probably heard it all, right? A million different explanations, and a lot of them just don't add up. It's all in your head. It's just inflammation. Go get your spine adjusted. That kind of conflicting advice can make you feel completely unheard. But we're here to tell you what you're feeling is valid because the real story is so much more interesting. And this is so important. Getting a handle on the real reasons behind your pain, well, it's not just about knowing things. It's your first real step toward recovery. There is a clear biological reason for what you're feeling, and that reason, believe it or not, actually holds the key to getting better. Okay, so let's get into it. What is really happening when pain just sticks around long after an injury should have healed? Well, it means the problem isn't just in that original spot anymore. The whole system has changed. It's gone from being a local issue to a full-blown systems-level problem. And here is the absolute core of the issue. You can see it right here. Chronic pain is basically a self-perpetuating cycle, a vicious feedback loop between your nervous system and your immune system. They get locked into this destructive conversation that keeps your entire body on high alert 24/7. Let's break down the two players on this team, starting with the nervous system. In chronic pain, something called central sensitization happens. Now, the best way to think about this is like the volume knob on your body's pain system gets cranked all the way up to 11, and then the knob breaks off. Your brain and spinal cord become so hyperexcitable that even normal feelings, like the touch of your clothes, can register as painful. And the second player? That's your immune system. It gets stuck in this state of low-grade body-wide inflammation. Imagine it's constantly releasing these little chemical alarm bells called cytokines. These alarms don't just stay in one place. They travel all through your body, acting like amplifiers, telling your already on-edge nerves to stay on high alert.
So you can see how this feedback loop gets going, right? The inflammation makes the nerves more sensitive. Then those super sensitive nerves signal for, you guessed it, more inflammation. They just feed off each other, creating this relentless cycle. And here's the critical part. This whole cycle can keep going for months, even years, totally disconnected from whatever started it in the first place. We've talked about the biology of it, but what does it actually feel like to live inside a body that's stuck on high alert? I mean, it's so much more than just pain in one spot. It's a full body experience with a whole range of symptoms that can seem totally unrelated.
There's actually a great way to map this out using the acronym S.P.A.C.E. So S is for sensory hypersensitivity. When bright lights, loud sounds, or even a light touch feel overwhelming. P is for pain amplification, where pain spreads and feels way out of proportion. A is for altered body perception, that weird feeling of being disconnected from your own body. C is for cognitive difficulties. That's the classic frustrating brain fog. And E is for the deep energy deficit and emotional distress, just a profound sense of unwellness. Now, when you see these S.P.A.C. symptoms all clustered together, it often leads to a bunch of different diagnoses, things like fibromyalgia, IBS, migraines, chronic low back pain. These are called chronic overlapping pain conditions, or COPCs. But here's the big insight. They often aren't separate problems at all. They're just different ways that the same underlying issue shows up, that centrally sensitized system we've been talking about. And that brings us to the most important question of all. If chronic pain is this complex, multi-system problem, if it involves both the nervous system and the immune system, how in the world do you even begin to treat it? It's pretty clear that a single focus approach just isn't going to cut it. The answer, as you can see, has to be a multi-system solution. It just makes sense, right? To break a cycle that involves both the nervous and immune systems, you have to step in on both fronts at the same time. This is why a team-based approach isn't just a nice idea, it's a logical necessity. So what does this multi-system approach actually look like in practice? Well, it's really a two-part strategy. On one side, you've got your manual therapists. Think chiropractors, physiotherapists. They're working to restore movement and give calming input to help turn down the volume on that oversensitive nervous system. Then, on the other side, you have practitioners like naturopathic doctors who are tackling that systemic inflammation head-on, looking at root causes like nutrition and lifestyle. And this is where the magic really happens, in the synergy between these two approaches. When you improve movement, It sends signals that actually help calm the immune system. At the same time, when you reduce inflammation, your nervous system becomes less reactive, which means things like physical therapy and exercise become way more effective. Each approach basically makes the other one work better.
So, what could your personal recovery team look like? Well, you might have physios and chiros helping restore movement and turn down that nerve sensitivity. You could have massage therapists helping break that awful pain and mobility cycle. Acupuncturists can help modulate pain signals through sensory input. And naturopathic doctors can dig into the root causes of that systemic inflammation. The key is that every member of the team has a distinct but complementary role to play.
I want you to really let this sink in. Your brain and your nervous system aren't set in stone. They are constantly changing based on the input they get. That's called neuroplasticity. The very same process that allowed your system to learn and amplify pain signals can be used to retrain it, to teach it new, non-painful patterns. Your body's ability to adapt is honestly your greatest asset here. Okay, so what's your path forward from here? It really comes down to 4 key steps. Number 1, seek out evaluations from people who get this multi-system view. 2, don't be afraid to ask about screening for inflammation. 3, commit to the process. You have to remember, retraining your body takes time. And number 4, and this is a big one, look for practitioners who actually talk to each other and work together as a team. So let's just quickly recap the most important takeaways from all this. First, your pain is absolutely real. It's complex, and it is rooted in your biology. Second, it's a systems problem. It's that feedback loop between your nerves and your immune system. That means a team-based approach isn't just an option, it's the most logical solution. And maybe most importantly, because of all this, real, lasting improvement is truly possible with the right support. We'll leave you with this final thought. The journey to recovery, it often starts not with a pill or a procedure, but with a new understanding. By starting to see your pain not as some mysterious, lifelong sentence, but as a biological process that can actually be influenced, well, you've already taken the first and most powerful step toward changing it.